Hey YouTube, this is Cynthia with Healing Holden. I just wanted to recap my COVID experience with what's happening now and how you can keep yourself from going through some of the long rona stuff and the after the post-COVID fallout that a lot of people talk about. I was having it too. So I'm going to try and make it real quick today, guys. I know you're used to me talking a lot, but surprise that we'll do it differently. So I just wanted to let you know, I ended up having a Spectracell done. I think you remember me talking, well, if you see my other videos, you remember me talking about Spectracell. So this is for micronutrient deficiency. And one of the things that started to happen to me, I got COVID in August and now it's December. And just a couple of weeks ago, maybe a week ago, I started noticing that my hair was falling out and my skin was getting really like dry, and not even just dry, like thick and not shiny anymore and just kind of funny. And I was swelling. So I had to get the Spectracell anyway, because you're supposed to get it like any other blood test, like once a year. If you're having a real problem, like with autistic kids or, some kind of serious autoimmune disease or problem, you get it done 6 times or 6 months, every 6 months until, you're okay again. You're on the mend and normal, and then it's just annually. So it was my time to get my annual check since the mold illness checkup, and I was having all those problems. I was having fatigue. My hair was falling out. Like every time I brushed my hands through my hair, it was like falling. I was having twice as much fallout in the bath. So this is what they found is very common after COVID infection. So I wanted to relay it to you because I think it's good information following that video that I did before. So that if you are ending up with COVID infections and you treat it with whatever you end up treating it with, you realize that sometimes, like if you do get sick, whether you're vaccinated, whether you're not vaccinated, whatever you end up doing, you may have some of these side effects, and you may want to know about this. So in my Spectracell results, I have a deficiency in, let's get you up there. There we go. Pantothenic acid, panthenate, selenium, vitamin A, and vitamin E. Those are my borderline deficiencies. My major deficiencies were asparagine, which is just a really weird one. That's an amino acid that comes from asparagus, calcium, and magnesium. So before I fall out of the frame, I just wanted to let you know what my doctor told me. So what he said was the asparagine is implicated in protein processing, and when you are basically wasting because you're lying in bed for 2 weeks like I was, your body will use up a lot of that to break down the proteins. And you're also breaking down fat. Believe me, it was good. It was like mono, like a good weight loss plan. But because it uses all its reserves, the body uses the reserves of the asparagine, and in some cases the rest of this, you need more. So I liken it to if you had an all-nighter and you didn't get any sleep at all, the next day, possibly a couple days, you're going to need to recoup that sleep. So you're going to get your normal sleep plus maybe 2 hours more, plus maybe the next day 2 hours more, and so forth, until you recuperate that sleep. And then you've got enough reserves of energy for normal sleep patterns. So it's kind of the same way. You need to recoup these micronutrients that you've used for the infection and for the resulting processes. And the way you do that is usually through supplementation, because you're already eating typically this stuff. You can do things like, if you're not eating, like, the doctor, since I have vitamin A as a borderline deficiency, Dr. Osborne always recommends eating liver if you like it. And you can bump up, other things to eat. But these are, especially the major deficiencies I had, were also like powerhouse players, at least the calcium and magnesium in the body. So they were really important to supplement with. And the asparagine, you just really only get that out of asparagus, and then the body will synthesize it by itself. So since it wasn't, able to recuperate, get back to normal functioning, because it uses it all up, I'm supplementing with it, and it's helping. My skin's getting shiny again. I'm not swelling as much. The hair's still falling out, but not as much. So I've only been on it for like a weekend. I can already see that the hair, like today in the shower, it was not falling out like double the batch that it usually does. So good, we're on the mend. That was a little bit frightening. I know it's not, compared to everything else, I got a nice cue ball head. I can handle it. But what he did tell me that I thought would be good for you guys to know, if you aren't getting a Spectracell, which I highly recommend you do, regardless of whether you've had COVID or not, but especially if you've had COVID, test, don't guess. So see if you can get one. The asparagine, the body uses up the reserves of protein. So what Dr. Osborne said was eat more protein, like kind of bump up for a little while your regular protein intake. And then you make it like you want to eat at least 1.2 grams of protein per kilogram of body weight. So do that. The pantothenic acid, usually sickness and stress, will rob you of that. The asparagine is because of the protein processing. Bone broth is good to kind of bump you up in a lot of minerals. So he said that selenium, magnesium, and zinc, those three he was seeing very commonly with COVID sufferers or COVID, post-COVID patients. So those three preserve vitamin E, and I was also low in vitamin E, and that prevents recovery in the kidneys and dictates how fast you can go. So it accounts for some of the fatigue I was having. So I wanted to let you know that because I thought it was good information if you are recovering from COVID. Because I remember when Alyssa Milano got COVID, she was on Twitter or something saying, "Oh, my hair fell out. It was awful." And yeah, okay, that happens. But there's a way to fix it. Like, you don't have to just go bald, So there's always a way to fix it, guys. And if you want to leave any comments and have any questions about that, I am well on my way on the mend. My skin looks better. My hair's not falling out as much. Oh, I was also having visual disturbances, which the vitamin E, a lack of it, and I had a lack of vitamin A, which also is implicated in COVID recovery. Really, a lot of different viruses take a lot of vitamin A. Zinc is the biggest one, but for COVID. But yep, that's all I got. All right, see ya. Hope you all have a great day. Talk to you soon. Bye.